All right. Good day, everyone. Let's wait for a few moments for the other attendees to come in. I hope everyone is having a wonderful day. And if not, we're confident today's webinar can turn it around and make it a great one for everyone here. All right, all right. Welcome to our Father Engagement Strategies for State Agencies webinar. My name is Justin. I am NFI's Marketing and Training Coordinator, and today I have the pleasure of supporting this training with you and our speaker for today, National Father Initiative's Chief Partner Success Officer, Mr. Erik Vecere. And you can see him online in our with his camera on over there. Very handsome guy. So, I know that we're excited to start, but let me just take this time to announce a few housekeeping rules and logistics for a smooth webinar for everyone today. We will be together today from now until 3 p.m. Eastern Time. And for the best experience, I recommend that you close any unnecessary applications so that you can ensure a stable internet connection and we can avoid those disconnections for you. This webinar is being recorded and it will be made available to participants within a few working days. You have to use, and you can also use the chat function to share your thoughts and interact with other participants here in this webinar. But that said, please refrain from using the Q&A box you see down below, like the chat box. So more on that. If you have any questions, please use the Q&A box or a tool found in your video. So we will address as many questions as possible in that box during the webinar. And if you have any unanswered questions, we will reply to you in an email after the webinar. Once your Q&A question is answered, it should be also available for the other participants to view. But please be advised that we may not be able to see your questions if you put it on the chat box, since it may be covered by the other messages from other participants. After webinar, you will receive a brief survey. We ask that you please take a few moments to let us know your thoughts, your suggestions about the webinar on how we did, if we were able to explain everything to you clearly. It's your stage to be completely honest with us. Without further ado, let me formally introduce to you our speaker for today, Mr. Erik Vecere. So he is our Chief Partner Success Officer in National Fatherhood Initiative. So what that means is that he develops and nurtures partnerships with network-based entities such as yourselves that have relationships with groups of human service organizations to help them assess their father friendliness and be more father inclusive. He also facilitates strategic planning meetings that culminate in action plans, provides trainings on NFI programs, and oversees the implementation of funded and non-funded projects. Mr. Vecere received a Master of Science in Organizational Leadership from Geneva College of Beaver Falls, Pennsylvania in 2006, a Bachelor of Arts degree in Communications from Robert Morris University, Moon Township, Pennsylvania in 1991, and an associate's degree in Letters, Arts, and Sciences from Pennsylvania State University, Altoona, Pennsylvania in 1989. So is everyone ready? All right. Let us know by giving us a holla on your chats. Erik, you may take it away.
All right, thank you, Justin, and good day to all of you. It's incredible to see all the greetings and all the greetings coming in from all the different time zones around the country. And official welcome to you all. I am also on my own fatherhood journey. I have two grown daughters and even just recently got married a couple of weeks ago and have two stepdaughters and two grandchildren. So I am covering a lot of bases in my fatherhood and grandfatherhood journey right now. But I'm really excited to be with you all to be exploring some father engagement strategies for state agencies. And so, as we get started, just to give you a snapshot of who NFI is, We were established back in 1994, nonpartisan, non-sectarian, nonprofit organization. We are the leading provider of father inclusive capacity building resources. And our mission is to increase father involvement by equipping communities and human service organizations with everything that they need, training programs, resources, to be father inclusive. Our vision, of course, is much broader than that, but very child centered. And that is that all communities and human service organizations are proactively father inclusive so that every child has an involved, responsible, and committed father in their lives. So that is really our reason for being, and ultimately to improve the well being of children by helping them be the best dads they can be. So, how do we do this? Well, we do it through capacity building partnerships with communities and organizations. That involves national, regional, and state network based organizations, state and county agencies, which is why you all are here today, as well as direct service providers and communities. And you can see here just a sampling of the types of organizations that we partner with at these different levels. What we do is we provide these partners with ready-made and customized solutions, things around programs and resources, training, collaborative services, which I'll be touching on in pretty detailed ways today, as well as technical assistance. And ultimately, we rely on uh, strategic alliances and partnerships with organizations and agencies like yours to ultimately help create healthier children, families, and communities. And given that you all are at varying levels at the nexus of fathers and families within your communities and with the partners, maybe the local implementation sites you work with, that is how we will work together in order to uh, achieve that goal. So, in the short time that we have together today, these are some of the benefits that I would hope that you'll glean from this. And that is first to identify key challenges to father inclusion, but really through the lens of state agencies, because you all have very unique pain points and challenges that you face. And so I really want to take a closer look at this through that lens. The second thing would be to apply tools and strategies for engaging fathers, and also to provide real world examples of how state agencies have successfully integrated father inclusive practices. There are a couple of case studies that I'll share with you today. And then finally, and this is always where the rubber hits the road, by the end of this, to develop some actionable next steps to promote father inclusion. So, this is all going to be funneling towards a final chat question for you all to think about one or two next steps that you can take based on some of the strategies and concepts that have been laid out for you today. So I always like to start out, first of all, with framing why we're doing what we're doing, and why it's important. And that is this key message that fathers are irreplaceable and an essential ingredient for child well-being. And that is, I think, within a more uh, interrelated approach to this, where, of course, moms are also irreplaceable and an essential ingredient for child well-being. We need both moms and dads working with the best interest of their children in mind. The reason that I look at this as the starting point is that there are a lot of dads out there that do feel like they can be easily replaced. In fact, there has even been some research that we did in a previous national survey of fathers' attitudes about fathering, where 58% of all dads believe that they could be replaced by another man in their children's lives. And so, this replaceability factor has an impact on the motivation of these dads to want to be the best dads that they can be and to invest in ways to build their fathering skills. So we really need to be doing everything possible to be sending out that message that fathers do provide a unique and irreplaceable role in the life of their children. So I want to start off here with a poll question. And just to get to know all of you a little bit more, it looks like we have over 340 people on right now, which is fantastic. But this will help me get a better sense of the types of state agencies that we would have represented here today. So if you wouldn't mind, just take a moment and select the category that best describes your organization, whether that's a state agency, um, college university, a state home visiting program, a state correction system, state family support, or a statewide nonprofit. And we'll give you a moment to complete that.
Hi, Eric. Sorry, while we're at it, can you make everyone from NFI a co-host, if that's possible?
Sure.
All right, we're getting a lot of responses here.
Yeah, looks like everybody's on the ball. We're getting quite a
Hmm.
few responses.
All right, so I'll be ending the poll in five, four, three, two, 1.5, 1 1/4, one, and zero. All right. All right. So it seems like we have 41% coming from state agencies uh, and government programs, 3% from college and universities, 11% from state home visiting programs or network of local programs, uh, 2% from state correction systems or programs, 6% for state family support or resource centers network, 19% for statewide nonprofit, and 18% for others. For those who answered others, feel free to share with us on chat.
Yeah, absolutely. Thank you all
There you go.
for completing that. And, it looks like a vast majority here represent a state agency, but we also have a few in some other categories as well. So, very good to know the types of state agencies that are partaking today. So I want to start with, first of all, addressing some of the challenges that the state partners that I've worked with over the years have expressed in varying ways through different partnerships and projects that we've done over the years. And it's no surprise that siloed departments, programs, and services can provide a challenge for um, folks who are in working in the state agency environment on that level. And this challenge of trying to keep things a little bit more interconnected and leveraging things from other departments can certainly be a challenge when uh, there are barriers between those departments. And I'll be sharing with you some ways that some of our partnerships with state departments and some of our collaborative services have really helped them to address that by, in some cases, using uh, comparable or standardized types of tools that can be used across departments, even though they are siloed. Those things can still be then looked at in a more interrelated way. But it is certainly a challenge that a lot of state agencies face. Agency culture infrastructure that lacks incentives for serving fathers is another challenge that many state agencies face. And those would be things like policy mandates that don't require or incentivize father inclusion. That is, again, another area that can be very challenging within the state departments or state type agencies because it's kind of like trying to turn the Titanic sometimes with making changes to different kinds of policies and mandates within that setting. Contract language, I mean, you're all familiar with that. If you're working at the state level on in any of these categories that we just looked at, um, contracts are really the lifeblood for moving forward in anything in the state agency arena, right? So if that language and eligibility criteria that is reflected in the contract language doesn't foster father-specific types of programs, it can be really challenging. And even here, I've mentioned gender-neutral programs and services because even though they may be gender neutral, because many of the state agencies have already been comfortable working with moms on a lot of these issues, that if it's just kind of done in a broader gender neutral framework, they still tend to lean a lot more on the maternal side of support. So that is why it is really important to think about father specific types of programs and services and resources because, you know, dads need to know that those programs and services are for them. And unless it really looks at specific things around what it means to be a man and men's health and things that are more specifically geared and even written with men and dads in mind, we're only going to move the needle so far to get dads more included in those fatherhood programs and services. The next bullet is around staff turnover. And I'm sure that you've all experienced that on various levels over the years in your work, in your environment there. But I know with working with a number of state agencies over the years that sometimes we just get that momentum going and we start integrating some things and getting some good outcomes and impact and return on investment. And then that one person that was the fatherhood champion there that I was working with ends up leaving or transitioning into a different role, and everything comes to a halt. And oftentimes, folks get put into those positions as like interim staff people that are just kind of holding the fort until the next person comes in, and then it's very difficult to even keep track of you know if that position is even in its same form as a result of that. But it can be really challenging to get that momentum built back up again, if at all, depending on the priorities of the next person that takes over that role, right? So staff turnover can be a really big challenge with that as well, and especially at those levels where somebody is at a decision-making level that can really move things forward. Lack of father-specific data collection, and that's something that makes it very difficult to justify why any type of a state agency should invest time and resources on father-specific tools and resources. Because if you can't really articulate, be it quantitatively or qualitatively, why that investment is really beneficial, then it's only going to go so far, if at all. No accountability measures tied to father inclusion. Some agencies on more, I would say, on a direct service level, have learned that if they tie accountability measures to things like performance reviews, where there is a formal element to their performance review that looks at how well are you engaging dads in your day-to-day work. Becomes a little trickier at a state agency level, but if there is any way to build in a similar kind of accountability measure there, you can be sure that there probably will be an increase of focus on father inclusion. Another thing that I've come across working with state agencies has been the challenge of standardizing programs and evaluations. And one of the challenges that state agencies face really comes down to this concern about endorsing any one program or service, right? So, and understandably, the thing that makes it difficult then is how do you standardize programs across, a state among a lot of local implementation sites so that you can have statistically significant uh, outcomes, right? That you can look towards. So this challenge of standardizing programs and evaluations is something that some of our state partners have done by offering some of our programs in terms of training and curriculum for programs for organizations that are interested in those, but also having other types of trainings and curricula that they offer for different types of family interventions. So for fatherhood, they might select one, and they might select some others for other specific things for moms or co-parenting or whatever it may be. And then funding streams with limited flexibility for fatherhood work. So some of the streams that come in to fund state types of initiatives and programs are earmarked for very specific things sometimes. What's cool is that some of our state partners have found a way to look at the father factor within some of those limited earmarks, where they are able then to unlock some of those funds towards father-specific programs and services, or local implementation sites that can focus on more father-specific types of issues. So those are some of the challenges. What about some tools or some ways to explore in terms of including dads within your state agency? One, of course, could be to create or use brochures, flyers, and digital content that speak directly to fathers. As I mentioned earlier, it's really important to have some of those critical issues that men and fathers face, and to have them written in a way that is, presented in a father inclusive manner. And that will go a long way. And those are usually very easy to distribute and to integrate into very diverse types of programs that may be part of your network. Another tool would be to offer staff training on how to be father inclusive. And again, we have had some state agencies that have done this on a large scale for folks, and we do offer a variety of different types of training, as well as different platforms and formats for those trainings to be as effective and valuable for those direct service staff, as well as the state level staff in those settings. Another tool might be to embed father inclusive expectations into requests for proposals, scopes of work, and performance metrics for local grantees and service providers. So we are seeing in some states very father specific RFPs and scopes of work for local grantees to be able to apply for. And when they receive it, then they will then be able to focus more specifically on the fathers in their community. Another tool, systemically assess agency level policies that may unintentionally exclude or discourage father inclusion. So looking at eligibility, visitation, documentation, and ensuring that the language within those policies are father inclusive. And it's amazing how many folks, when they take, and I'll be sharing more about the father-friendly assessment in a moment, but when they take a father-friendly assessment, how it reveals and raises awareness of things that they hadn't even thought of in terms of um, some of the policies that unintentionally excluded father inclusion. And then offer ready to use father inclusive messaging, social media assets, and testimonial videos for local sites to use. So if you can think about like turnkey types of approaches that you can package for your local implementation sites to use, and to make it adaptable enough to the diverse settings, that's going to go a long way to um, not only helping those local implementation sites be more father inclusive, but really in turn bubble up to your state agency as well. So I mentioned the father-friendly checkup. We have two tools and that are free for you all to use or to refer your local implementation sites to that they can get at the link that I have up there, which is fatherhood.org/fatherfriendly. And the first tool is called the Father Friendly Quick Check. Now, this takes only about 10 minutes for somebody to complete. It's a series of a total of 40 statements that uh, folks will just answer true or false to. And when they complete it, they will get basically a score for what they got, how they answered those questions. And on the web page that we offer these assessments, you can also download a father-friendly action plan. So the goal is to, use the father-friendly quick check to inform the next steps using that template in order to guide the next steps in a way that is going to be rooted in some actual data. The other tool, which you'll find on that same web page, is called the Father Friendly Checkup. And in comparison to the quick check taking 10 minutes, the checkup takes 45 minutes to an hour. It's much more in depth and it provides statements on a Likert scale instead of a true false. And at the conclusion of taking the online assessment, you get immediate results that convert your statements into your scores under 4 assessment categories. And that's the same for the quick check as well. They do assess the same 4 categories of father friendliness. So you would have leadership development, organizational development, program development, and community engagement. Those would be the 4 areas that both of these assessment tools will assess. And similar to the quick check, you can download the same action plan template and use the results that get emailed to you or your local sites in order to inform the action plan and actually give them some very manageable next steps. And that's really what I love about these tools is that uh, it really comes out to a lot of low and even no cost types of solutions and next steps that they can take. And also things that are very manageable. I mean, we're all strapped for time. We have a lot of competing priorities. And so these tools are designed to really help that process of narrowing things down to, what makes the most sense and what is most doable for you or your partners at this time. It's about that, the low hanging fruit, right? So that's what these really help to facilitate. Now, if you wanted to take it a step further and be like take a more formal assessment of your local implementation sites or your network of partners, we do have at NFI what we call our Father Readiness Network Assessment. And this is a service where NFI manages the process of assessing your local partners from start to finish. And we do this all, online. We compile all of the raw data and we customize some of that so that when we give you the feedback at the state level, it's actually going to be rooted within the uh, specifics of your unique setting. And so we do dedicate an NFI expert to your project. There are kickoff and action planning webinars for the local partners. And then we would provide you with a detailed assessment of your overall network and each local partner with customized report and results, including recommendations to your state agency. So just as a case study for a Father Readiness Network assessment, we've been working very closely with the Georgia Department of Public Health for many years now, and they have already completed 2 rounds of an FRNA. They did one for educational and nonprofit local partners, and they did one for their children medical services, which are really the children and youth with special needs component to their network. They're also currently conducting an FRNA for their Babies Can't Wait program, which is interpreted in many states as the early intervention program. And they're also scheduled to conduct another FRNA this year for their home visiting partners. So we are doing a lot of FRNAs for Georgia DPH. And what has come out of it so far in the first two FRNAs that we've completed, there have been 74 father-friendly checkup assessments completed and about 50 father-friendly action plans created by their local implementation partners. And as a result of all of that data that's come back, we have provided two customized reports with results and recommendations that have informed DPH's approach to increase father inclusion in their local partners programs and services. So, what does one of these reports look like? I thought I would just pull this up real quick to show you. This is a father readiness network assessment uh, final report that we provide to our state agency partners. And we do an introduction where we highlight what the assessment process was, how we prepared the staff to complete the assessments, what the deadline and follow-up was, how many assessments and partners participated, how we scored the assessment, the variables that DPH chose for us at NFI to interpret and guide our recommendations. So they chose basically what they wanted to know was how did these four variables affect the father-friendly scores of the folks who completed the assessment. And so they wanted to know by staff role, whether they were a children's medical services staff or not, the public health district represented, and then the years of service. And then, we went through and summarized all of the assessment results from all of the staff who completed the assessments and what those scores were by those assessment categories. And so we did that for all of the different variables that they selected here. And you can see, like, even by years of service for less than 1 year, um, you know, we had a 68% overall score versus 1 to 3. It jumped to 73. So you can really start to see, okay, well, what might be causing these things? And that's really where the recommendations come in. And that's the final section of our report here, where we just provided them with a number of different recommendations that the Georgia DPH could consider as they try to support their local partners around father inclusion. And so you can see we gave them 8 different recommendations and then the conclusion. So that's, again, just an example of one of the outcomes of a father readiness network assessment that we uh, did with Georgia DPH. These are a few other agencies that have done an FRNA with us. Family Support Organization of Essex County in New Jersey, Juvenile Welfare Board of Pinellas County in Florida, Summit County Public Health in Ohio, a couple of national organizations, AMCHIP, National Association of County and City Health Officials, CareNet, Commonwealth Center for Fathers and Families, and Ounce of Prevention Fund in Florida. So you can see there's a diverse representation of different types of agencies who have benefited from the FRNA. So we talked about challenges that you have at state agencies as well as some tools, but I also wanted to talk about some potential strategies that might be helpful for you to consider as you think about father inclusivity throughout a state agency. And these are some things that I've come across over the years that I've seen that have been successful with some of our partners, forming a cross-agency work group to coordinate efforts, share best practices, and align policies affecting fathers. So, that's one way to address that challenge of silos is, to create a cross-agency or a cross-departmental work group. And those often bear a lot of fruit. So, I would encourage you to explore the possibility of coordinating something like that. Provide technical assistance and coaching to local implementation sites to tailor strategies and overcome site-specific barriers. Because as you all know, you have a diverse representation of different local sites that you are working with. And they may be all over the board in terms of, settings and, some might be in urban or suburban or rural types of settings. They may have a variety of different types of issues that they are addressing. So, strategies have to bend a little bit in those scenarios in order to make it work for those sites. The third bullet here, identify and promote effective local father inclusive programs for replication across other counties or departments. This is something I like to call bright spots, finding the bright spots so that you can learn more about them, why they are a bright spot or a best practice, and then figure out a way to replicate those or at least help other sites who might not be as far along leverage some of the things that these other areas or programs have been able to uncover and be successful with. Another strategy would be to tie funding, recognition, or performance bonuses to measurable improvements in father inclusion and retention. So again, if you can tie in any kind of means to help motivate folks to be more intentional when it comes to father inclusion and just looking at their daily activities. It's surprising how many folks who are in direct service will realize that there are things that they can be doing, even if they're just working with the mom, to begin raising questions about the dad's involvement in the child's life and in the family's life. And even in those questions, what we're doing is being more father inclusive, right? So that is certainly an area that a lot of folks will recognize that, what, there are a lot of just little things I can do in my interactions to be more father inclusive. You can use father advisory panels, listening sessions, and focus groups to guide program design and delivery improvements. So, again, one of the, I would say, common threads in the most successful fatherhood initiatives that I've seen have some kind of a feedback loop for dads to be able to provide input into the development and enhancement of the programs and services. And then recognize and highlight father inclusion through events, awards, and public campaigns. And these, again, these are ways that you want to think about, for example, with public campaigns, what is the end goal in that? Yeah, it's certainly to raise awareness, but also, what are the next steps that the campaign can put out there to ensure that we're moving from inspiration to implementation, right? So that is always a big part of what I try to do is moving towards actionable next steps as a result of raising awareness in the first place. So while we're talking about strategies, NFI has another service that we provide that has helped a number of state agencies come up with what we call a father engagement game plan. And it gets really tricky to try to coordinate a strategic plan at a state level because there are so many wheels in motion, so many competing priorities. How do you you know, get your mind around what can be done and when it can be done is really challenging. So we have what's called a father engagement experience. It is a 2-day strategic planning session that we facilitate. And what we do is we actually design a process customized for your situation and focusing on what the goal of the session is and what you want to accomplish as a result of that. What's really cool about it is we use these storyboards, so these big boards with the index cards, and you can see some of these pictures here. Very interactive, and it enables us to, move things around up there, prioritize things, regroup things, and make sure that, we're capturing all these cool ideas, but in a way that makes sense, right? We also use what's called pure form thinking, because these are really complex types of problems that we're trying to solve and get to a who, what, when, to get to an action plan. And even in a day and a half where we do these, that is not a lot of time to be managing something like that. So this pure form thinking, what we do is we just have people use first the right side of their brain. So it's only about creative, the creative side, getting as many ideas up there as possible. Then we take a break and we do multi-voting, where everybody gets 5 votes. They get to pick the top 5 ideas for that particular thing that we just brainstormed. And then we move to the left side of the brain where we start analyzing all of these things and deciding, okay, what's feasible, what isn't, what have we done before in these ideas? What can we learn from stuff? And ultimately, what do we want to move over to our action plan out of these ideas? So the culmination of the 2 days is what's called the Father Engagement Game Plan. And again, just as a case study example, we worked with the Iowa Department of Human Services and did a father engagement experience. And I'll just pull up their father engagement game plan that came out of that, so you all can see behind the curtain a little bit. And so this is the final report after we completed our 2 day strategic planning session. Um, there's the table of contents. So we've got session participants, who is there from which organization, and then this was the design of the 2 days that I was able to put together with them, with their team, ahead of time, so that when the other participants came in representing the state agency staff and partners, we already had this up and ready to go. So we had the overall objective here at the top. You can see that. We had some background information. The overall purpose for the strategic planning session was to create a statewide network in the next 6 months that will initiate, facilitate, and support a variety of programs and/or resources for both dads and moms, both custodial and non-custodial. Um, so again, this is the 30,000-foot view. But then when we get into the purpose of the session that we did, it was to determine why a state network is needed, the goals of a statewide network, and to identify at least 3 viable organizations that can successfully oversee the statewide network. You'll notice that there are a lot of very specific timeframes in these statements, like to create a statewide network in the next 6 months, right? To identify at least 3 viable organizations. So there are certain things that are baked into the design ahead of time. And then this non-purpose of the session is something that is extremely valuable. And these are the things that could possibly derail the 2 days of discussion and strategic planning. And so you can see that there, were a few that we identified as things that we don't want to talk about during our time. So that gives me as a facilitator the power, if you will, to hold them accountable for that, because I can just come back and say, that's great, but this was a non-purpose that we established. So why don't we, parking lot that until a later time? And then here, these were header cards up here. These were the things that we were brainstorming. So we wanted to figure out reasons why a state network is needed. And so these are all the different ideas that folks put out there. And then we categorize them into these different categories. And then here we wanted to brainstorm goals and objectives that have a successful statewide network. Um, and you can see different categories came out of that. We have attributes that an agency would have to oversee a successful statewide network. Before we could identify potential lead agencies, we needed to know what do they look like? What are the attributes? So we brainstormed that, and then we brainstormed the list of agencies to reach out to. And then the final thing, as we got into the last day, they really wanted to work on a mission statement. And so we worked on words and phrases to include in the mission statement that they then pulled out and used to create their final version of their mission statement. We also captured all of the top vote getting ideas so that they could refer back to that, which is on this page here. And then finally, this is where the rubber hits the road, folks, right here, the action plan. What are the next steps and who is going to be accountable for those next steps and by when? And so that's all captured here, along with what the status is of each of those different tasks. So again, that's just an example of something that has been effective and valuable for uh, a number of state agencies that we've partnered with. So either the Father Readiness Network assessment that we've done with the Georgia DPH example, or a father engagement experience like we did with Iowa HHS. Those are things that we've been able to uh, have some successful outcomes with those folks in those situations. And it does address a lot of those challenges that I listed out for you at the beginning. This is a list of just some other agencies that have done a father engagement experience. You can see, Tennessee Department of Human Services, Wyoming Children's Trust, Kansas DCF, CareNet, Juvenile Welfare Board of Pinellas County, Kalamazoo County Health, and even the Tracy Family Foundation in Missouri. And as we are in the home stretch now already, I wanted to just share with you how state agencies usually fund work with NFI to do some of these things. And we've seen, some utilize the community-based child abuse prevention funds. Some have used TANF dollars. Uh, Women, infants, and children sometimes have things with the special supplemental nutritional program that can now support father-specific types of programs and services. McV has been a big component in terms of some of our partners, especially in home visiting, to be able to use some of the maternal, infant, and early child home visiting funds to do father specific types of activities. There's also the Title V Services Block Grant. There's Title 4D, which is around child support. Title 4B, Parts 1 and 2, with child welfare services. Access and visitation, mandatory grants. There are some education grants out there around Title I. Second Chance Act, state-funded fatherhood and parenting initiatives is another source of some funding that our partners have used. I've also included a handout that you all, if you haven't received already, you will be getting in an email along with all of the slides that I just covered. But it's called NFI's capability statement, and it will go into more details on how NFI works with government agencies. So I would encourage you to take a look at that and see, if anything makes sense for you where you are or where you might want to be here in the near future. Some non-NFI resources that I think are helpful, two of which come from the Fatherhood Research and Practice Network, FRPN. They have a research brief that is called State Approaches to Include Fathers in Programs and Policies Dealing with Children and Family. So I have the link up there for you on that. And then another great resource that they have produced is the Policies and Programs Affecting Fathers. What's cool about this is that it's a state by state report. So you should be able to find your state in there and kind of get a objective perspective on policies and programs affecting fathers in your state. And then I've included two from the McV world. These are webinar transcripts, and these are produced by the Health Resources and Services Administration. That's HRSA. And these are both webinar transcripts. And one is just on engaging fathers in McV, and the other one is making McV more father friendly. So if you are working in the home visiting realm, I know we had a percentage of folks here representing home visiting programs. Those might be helpful for you as well. So this is the rubber hits the road, folks. This is where hopefully at this point, maybe there was something that sparked some creative juices to get them flowing. But I'd like you to just reflect for a moment and think about one next step you can take to help your state agency become more father inclusive. And you can go ahead and type your answer into the chat question. So we'll give you a moment to do that, and then we'll have a few minutes for any questions. If we don't get to your questions, we can definitely connect offline, and you can feel free to reach out to me in order to do that. But I will pause and just give you a moment to reflect and think about one next step that you can do to make your state agency more father inclusive. I see a lot of good things coming in here too. Does my heart good to see so many great ideas popping up in there. All right. So as you are, thinking about that one next step, I know many of you have already jotted that in there into the chat question. Thank you for that. Um, we do have opportunity if there are any questions. Melissa, I don't know if there was anything that you thought we would be able to answer here while we have the whole group.
No, not as of yet, but if anyone has any questions that have not been answered yet, feel free to drop it in the Q&A. Here's one interesting one. How do you address situations where staff are actively opposed to serving fathers?
Yeah, well, that's a challenge, I would say for sure. I think that it's always good to try to find out a little bit more about the why behind the action. And, maybe there are some things that they have experienced either personally or professionally that, have shaped their worldview or their paradigm on this issue. And really, until you get to that, it's going to be very difficult to navigate where to go from there. But I often will say, look for even if you're the Lone Ranger and you're the only fatherhood champion in your agency, you have tremendous influence over other people. And there may be some that might never get on that father inclusive bandwagon. I mean, we can't control things beyond ourselves, right? So the more that you can do within your purview and your sphere of influence to begin raising up, or at least raising awareness, but ideally raising up some other fatherhood champions that um, sometimes will kind of create a tipping point. And even the folks who were very resistant or just outright against it eventually, might be more open to it. But until you know a little bit more about why they're feeling that way, and explore that, it would be very difficult to make any progress, I think, with that individual. So I would certainly encourage you to start there, and then, have um, your qualitative examples and quantitative examples ready to go when they are open to hearing a little bit more. Make sure that you're comfortable enough presenting why you're passionate about it. Maybe you have some personal stories, um, maybe within your own journey as a parent, or within your family, or maybe the work that you've done, some of the impact that you've had as a result of being more father inclusive. Because it really does come down to relationships and where your heart is. And I think that if we're authentic in how we present things and certainly consider it as we're doing the having these conversations, but also prepared with data and research and things that you can actually find on our website at fatherhood.org. We have a whole research and evaluation section on our website that can provide you with all kinds of things to reference when those opportunities come up.
Okay. I don't think we have any other questions specifically related to the services today that I'm seeing. So I think we're all set here.
Okay, great.
There's a
I've put,
Melissa Gibson with their hand raised.
yeah, Melissa has her hand raised. I don't know, Justin, if she can unmute or not, but be happy to take a question or a comment.
Hi, Melissa. You can put your question in our Q&A, and if you can also email us to info@fatherhood.org if you want to discuss something in more detail. So I put our email in the chat here.
Okay, great.
Mhm.
Yeah, certainly, as I mentioned earlier, if there's anything we can do offline, we're probably not in a position to solve all the world's problems today on in a 1 hour webinar, but we are certainly here at NFI to support you, come alongside you in any way that we can in your efforts to be more father inclusive at your agency level and or with your local implementation partners or local sites that you are working with within your network. So would certainly encourage you to reach out. I do have my contact information up here as well. If you want to email me, that's evecere@fatherhood.org. And so, as we're wrapping up, I'm often reminded of the quote by the great anthropologist Margaret Mead, and she was quoted as saying that the primary task of every civilization is to teach their young men to be fathers. And I always found that very simple but profound. Here is somebody who has done nothing but study culture and society from the beginning of time. And this is a common theme that she has found is how important raising up the next generation of fathers is to our communities. And we don't have to look far in our backyards to see what happens when things start to break down at that level, whether it's an, a dad not involved or a mom not involved, but collectively, we know children need both involved, responsible, and committed moms and dads, right? Coming full circle from that key message at the beginning. So I want to just thank you all for attending today, for being open to uh, moving the needle on father inclusion in your state agency. And I want to thank you all for the great work that you're already doing to enhance and enrich fathers and families. So if there's anything that we can do here at NFI, please don't hesitate to reach out. And I certainly would love the opportunity to hear more about the great work that you guys are doing and see if there's any way that we can support those efforts. So I hope that you all have a wonderful afternoon.
Thanks, everyone.